Hi guys, good evening, good morning, good afternoon to you from wherever it is you're joining. It's Flow Talk Wednesday, and it's a Q&A session, Flow Talk Wednesday. So for those of you who have questions regarding your ovulation, menstruation, pregnancy, you can go ahead and drop your questions, and I will have your answers provided in real time. Now, just before we start taking questions, yes, hello, Allow, Ganiat, how you doing? All right, awesome. Okay, so without wasting much time, let's start the session. So if you have a question pertaining to your ovulation period, pregnancy, anything related to those three, please, you can go ahead and drop your questions, and I'll provide you answers in real time. Meanwhile, let me start off by answering two questions that I saw on my timeline on Instagram. The first one, the lady was asking to know if a woman who has undergone an ectopic pregnancy. All right, she had an ectopic pregnancy, and one of the tubes where the ectopic pregnancy was located, was cut off. She wanted to know if she would still be able to conceive, and the answer is absolutely yes. Pregnancy is still very possible. All right, don't forget that there are two ovaries and there are two fallopian tubes. There's a right ovary, there's a left ovary. Each of the ovary is connected to its own fallopian tube. So in our own case, one of her ovaries, I think is the left one, the tube connected to that ovary had an ectopic pregnancy, and because given how very serious ectopic pregnancy is, they had to extract the pregnancy to save her life. So the tube was cut off. Now she's left with one ovary. She's left with two ovaries, but only one fallopian tube. That's the right one. All right. Now, the way it works is, if the right ovary, which is still connected to the right fallopian tube, is functioning very well, that means that ovary is releasing eggs, and the right fallopian tube is also open, it means that pregnancy can still happen, because sperm cells can still be able to travel through that fallopian tube to reach eggs. So whether or not pregnancy can happen will depend on the state of the ovary and of the fallopian tube. That's the state of the right ovary and the right fallopian tube. Now, this is for natural conception, all right? For penis in the vaginal type of sex that leads to pregnancy. In the event that the right ovary is not ovulating or releasing eggs, or the right fallopian tube is blocked and pregnancy cannot happen, there is the option of IVF, artificial conception. Artificial conception can be instituted, during which the ovary that is releasing eggs, which is the left ovary, eggs will be harvested from that ovary, then an IVF will be performed, and the embryo or the resulting embryo will be inserted into the woman's womb, and she will carry it to term. So she still has options. She has two options. One is to go the natural route, and the other one is to go the artificial route with the use of IVF. So pregnancy is still very much possible, depending on the state of the other ovary. That's the first question. The second question is, a lady was asking to know, can PID cause infertility? I think I've done a video on this before, and the answer is a yes. PID can cause infertility. An untreated PID, pelvic inflammatory disease, it can lead to infertility. You see, the thing here is, sometimes, or for the majority of women, they are not even aware that they have PID, because the infections or the STD which cause some of the STDs which cause PID, they often to an asymptomatic route, meaning that they are often silent. They rarely show symptoms in women. All right, for example, chlamydia, for example, gonorrhea, they rarely show symptoms in women. All right, so the woman would have stayed with the infection for months or even years, and staying with the infection that long can lead to damage of the can lead to damage, scarring of the womb, and it can even ascend to the tubes and cause blockage. So by virtue of causing or being able to cause tubal blockage or blockage of the fallopian tubes, a pelvic inflammatory disease can certainly cause infertility. All right, it can cause an infertility. Don't forget that when the tube is blocked, eggs will not be able to reach the sperm cells will not be able to reach the eggs, and as such, fertilization will not be able to take place. So, having said that, let's take questions. Let's take questions from here. All right, let's take questions. Meanwhile, guys, you can share the link with a friend, invite them to join. Also like the live session so that the algorithm will be able to boost it for other people to see. All right. So there is a question here. Ganiat is asking, must I operate hydrosalpinx? Yes, you have to operate it. Okay. Now the thing here is, for those of you who may not know what hydrosalpinx is, it's just a collection of fluid in the fallopian tube. So either the fluid is collected in the right fallopian tube or it is collected in the left fallopian tube. All right. The problem with this is that such a fluid collection can cause or affect a woman's ability to conceive. So it's a common cause of infertility. All right. It's a common tubal factor infertility, hydrosalpinx. All right, because it distorts the shape and integrity of the fallopian tube and makes it difficult for a pregnancy to happen. Now, it becomes worse if the hydrosalpinx is bilateral. So either the hydrosalpinx is on one side, is affecting only one tube, or it is affecting both tubes. If it's affecting only one tube, we call it unilateral or left hydrosalpinx. If it's affecting both tubes, we call it bilateral hydrosalpinx. All right. Now, if it's affecting one tube and you are now having difficulty with conception, well, that has to be fixed surgically, of course. All right. So surgery has to be done. Now, there is also the option of IVF or artificial conception, where you do IVF then transfer the embryo into your womb. But even if you are going to go the line of IVF, research or studies done have indicated that even when you want to go for IVF, it is very important, or it's good that you have that hydrosalpinx operated, because it improves the chances that the IVF is going to be successful. What am I saying in essence? That, if you go ahead with an IVF while you still have while you still have an hydrosalpinx that has not been corrected or treated, it can increase your chances of failure. All right. So even if you are not you don't want to do the surgery simply because you think that IVF is an option, to increase your chances of getting getting a successful IVF, it is suggested or advised that you also have a surgery done for the hydrosalpinx. All right. Okay. Next question. Hi, good evening, doctor. Please, what could be the cause of delay after doing HSG and all the tubes are open? Are you ovulating? All right. So you can do HSG and the tubes are open. The two tubes are fine. All right. The womb is also very fine. It's adequate for conception. All right. But if you are not ovulating, you are not going to be able to conceive. All right. So having patent tubes is just one factor that must be met, or one condition that must be met for natural pregnancy to happen. The other one is ovulation. Ovulation has to take place. So are you ovulating? If you are not ovulating, then you need to find out the reason why you are not ovulating and address it. Okay. So that's on your own side. There's also the factor, or the male factor. All right. So is your husband or your partner medically sound or fit to mastermind the pregnancy? So I would expect that at the very least, a seminal fluid analysis would have been done to ascertain the parameters of his semen. All right. So we want to know whether the sperm count is adequate. You want to look at the motion, the motility of the sperm cells. These are all parameters that can indirectly or even directly affect a couple's ability to conceive. So the investigation has to be both ways. As they are investigating you, your husband also needs to be investigated. Extremely very important. Now, if you have done all that I have mentioned so far and everything is fine, your husband is 100% fine, you are also 100% fine, you are ovulating, you have done ovulation scan shows that yes, indeed, you are ovulating, your husband's semen parameters look excellent, then if you are unable to conceive within a period of 12, at least, for up to a period of 12 months after regular ejaculatory, unprotected vaginal intercourse, then we'll call it unexplained infertility. So there is something called unexplained infertility. As a matter of fact, up to about 20% of cases of infertility are unexplained. Up to 20% thereabout. Is it up to that? Yeah, there is no. I mean, is it 5 or within 5 to 20%? Within 5 to 20% unexplained. Am I right? 5 to 20% unexplained. Okay. A common explanation. One very common explanation for unexplained infertility is something that they call luteinized unruptured follicle syndrome. I explained this last week. All right. And what does that mean? Essentially, it means that you are maturing eggs. Your ovaries are producing eggs. In fact, the eggs mature up until the point where they are about to rupture, but they fail to rupture. We call it luteinized unruptured follicle syndrome. And there is a way to actually go about that. There are ways or interventions that can be instituted to address luteinized unruptured follicle syndrome. Okay. Next question. Kerry is asking, can I still get pregnant if Provera is given to induce my period? Yes, you can. As long as you are ovulating, you can get very pregnant. All right? You can get very pregnant. As long as you are ovulating, you can get very pregnant. You only have issues with pregnancy when you are not ovulating, or when you have tubal blockage, or when your partner is not producing enough sperm cells. Then you're likely going to have issues with fertility. All right, but certainly if you are ovulating, your tubes are fine, and your partner is also medically fine, yes, certainly a pregnancy should be able to happen. All right, and using Provera should not stop you from ovulating. Okay. Now the thing here is with hormonal contraceptives, with some of these drugs, oftentimes quite a number of women who experience issues after using these medications experience issues because they already had prior hormonal problems. They had hormonal issues before they started using those medications. Ordinarily, if you never had any the likelihood that they will interfere with your cycle is very, very low. But if you had issues with your period prior to taking the medication, if you use the medication, that issue is still going to be there. The medication is not going to make the issue vanish. Okay, so it's important that it's one of the reasons I emphasize that before you use hormonal contraceptives, it's important that you discuss with your doctor, particularly the long-term ones. You discuss with your doctor, because for some women, their medical history may not favor the use of some of these contraceptives. So it's important that you know what it is you are going for. Next question. All right. If you have any question, please go ahead and drop. Okay, I'll be here for a few more minutes. Have any question pertaining to your period? Meanwhile, guys, kindly help to share the link with a friend to join. Okay, like I did explain the last time, I shifted the session. I moved the platform from Instagram to YouTube to grow this platform as well. All right, that was the reason why I had to move the Flow Talk Wednesday live Q&A live session from Instagram to YouTube, so as to grow this platform. Okay, so we are going to be having the live sessions on every Wednesday on YouTube until further notice. Now, it's a good thing for those of you who are joining at this point in time because you get to have all your questions answered. All right, so if you have any question, you have the luxury. I mean, I'm going to be here for the next 15 minutes at least if there are questions coming in, and I get to answer and exhaust all your questions. You can ask multiple questions. Eventually, the platform is going to grow. In fact, it's growing quite well. We are about almost 4K subscribers. The last time I checked, almost 4K subscribers. All right, so it's going to grow eventually, and we'll get to a point where, the live session will be quite, quite robust, and you may not have the opportunity to ask multiple questions. So if you're here, you have the opportunity. Go ahead, ask all the questions that you may want me to answer, and I will give you, replies in real time. Okay. Another question here, please, doctor. Can't low sperm count? Is it low sperm count be treated? Yes, it can be treated. Low sperm count can be treated. However, that would depend. The treatment or the extent of the treatment will depend on the cause of the low sperm count. There is mild low sperm count, there's moderate low sperm count, and there's also severe low sperm count. Okay, so if your low sperm count is below 5 million, I think, is below 5 million, you have severe low sperm count. Oftentimes, for people like that, after therapy, after drug therapy, if the problem is not addressed, they might just be the couple may be advised to go for an IVF for severe low sperm count. Then you have moderate low sperm count, where the sperm count is between 5 and 10 million per millimeter of semen. Okay, between 5 to 10 million cells per millimeter of semen. That's moderate low sperm count. Then you have mild low sperm count, where it is less than 15 million but more than 10 million. So in between 15 and 10 million, we call it moderate low sperm count. Now, for some people or for some men, they can get lucky. Even with mild low sperm count, a pregnancy can happen naturally. But once the low sperm count is getting to moderate and severe, natural conception becomes increasingly difficult. And for people with severe low sperm count, if after drug therapy, that count cannot be improved to a stage where pregnancy can happen naturally, then they just advise them to go for an IVF. All right, to go for an IVF. But back to the question. Yes, it can be treated. There are several causes. For some men, it's due to hormonal problems. Okay, for some men, it's due to hormonal problems. For others, it may be due to issues with their testicles. So, for example, some people can have what we call varicocele, where the veins of their testicles get, we call it the pampeniform, venous plexus, can get engorged and can affect fertility. Some people have what we call hydrocele. All right, these are all problems. Sometimes it can even be due to infections. Okay, that can limit or compromise a man's ability to produce healthy and adequate sperm cells. So it will depend on the cause. Treatment will depend on the cause. All right. Lara is asking, please, is it possible to test positive for pregnancy and still have a blocked tube? I have 2 miscarriages. Yes, certainly. Oh my goodness. Yes. All right. It's possible to, like I said, you have 2 tubes. All right. You have a right tube and you have a left tube. Now, even when the 2 tubes are blocked, pregnancy is still very possible. You know why? Because there is something, the tubes can be blocked completely or partially. So there is partial blockage and there is also total blockage. If the 2 tubes are completely blocked, total blockage of the tubes, then natural pregnancy will not be able to happen. All right, but if it is partial pregnancy, if it is partial blockage, then certainly pregnancy can happen, because there is still there is still a pathway through which sperm cells can, smuggle or, wriggle through to get to the egg. So, pregnancy can still happen. In fact, for women who have partial blockage, what we typically see is a case of ectopic pregnancy. So their risks of having ectopic pregnancy also goes up. All right, but certainly pregnancy is possible. All right, pregnancy is very possible. Lara, you say you have had 2 miscarriages at what gestational age? How many weeks? Next question. Please, Doc, can't you explain how to calculate ovulation? I've explained ovulation, how to calculate ovulation. It's in fact, I think I even did it like 3 weeks ago. So go to the previous sessions that I had. I think the first one I had on YouTube, I explained how to calculate it again. So just go look at it. You go scroll through that particular video. You'll get to a point where I took time to explain, to explain how to calculate your ovulation. Okay, for those of you who want to use the manual method, calendar method. All right. Yes, I already explained that. Next question. Can I get pregnant if I don't get egg white cervical mucus during ovulation? Yes, absolutely, you can. All right. Now, while the presence of cervical mucus is one of the signs that ovulation is taking place or ovulation has taken place, the absence of it does not automatically imply or mean that ovulation has failed to happen. So ovulation can take place without, ovulation can still take place without you having, cervical mucus. Same way, it is also possible, listen, it is also possible that sometimes you may see the cervical mucus and you may not end up ovulating. So for example, I mentioned luteinized or ruptured follicle syndrome a few minutes ago. These are women who, their ovaries mature eggs quite all right, but the eggs fail to drop. For such a woman, she will have all the signs of ovulation. She's going to have cervical mucus. She may even feel very horny. She may even feel very horny and have all the other signs of ovulation. But the problem now is that ovulation fails to happen because the egg fails to drop. So, in fact, if such a woman does a blood test, it will show that ovulation took place. It's just that the egg did not drop. So it is still possible that, you can see cervical mucus and an egg fails to drop. But generally, when you see cervical mucus, it's a sign that ovulation, at least the egg grew to a point of maturity. Okay? But again, the absence of cervical mucus does not mean that ovulation cannot happen. Ovulation can happen even in the absence of cervical mucus. And by the way, there are many factors that can affect the consistency or volume of cervical mucus. Maybe you are dehydrated or you are taking some medications. It can affect the consistency and volume of your cervical mucus. Next question, can the use of Clomid to stimulate ovaries cause the envelometrium to be thin? Now, so the thing with Clomid, right? The thing with Clomid is not a hormonal contraceptive, okay? Clomid is not a hormonal contraceptive. So it's unlikely that it's going to have that effect. Where Clomid plays a role is to a large extent, they call it ectopic pregnancy. So yes, some studies have shown that use of Clomid can increase your chances a little bit of having an ectopic pregnancy. That is one area where Clomid has been known to to have an effect. It can increase your risk slightly of having an ectopic pregnancy. All right, not just an ectopic pregnancy, it can also increase your risk of having what we call multiple pregnancies. So you can have a twin pregnancy, you can have in fact triplets, and this is one of the reasons why some women are abusing the drug. By the way, having multiple pregnancy, whether twins, triplets, all right, triplet gestation, twin gestation, is a high risk pregnancy. So we don't come out and give people Clomid just because we want them to have twins. It's an abuse of the medication, and I want to use this opportunity to to encourage those of you who are desiring twins. Please don't go and start abusing Clomid because of some of the potential side effects like ectopic gestation. Okay, all right, next question. Next question. Can the use of Clomid? All right, please. Can someone with PID get pregnant after treatment? Yes. Once. So the thing with PID is, if tuber blockage has not already happened, if tuber blockage has not already happened, if you treat the STD, you treat the PID, certainly you are going to conceive. Okay, in fact, it is even still possible for you, it is still very possible for you to get pregnant while you have an ongoing pelvic inflammatory disease. If you have an acute pelvic inflammatory disease, you can still get pregnant while the infection is still there. It's just that the infection can increase your risk of a miscarriage. Okay, pregnancy can still happen. Pregnancy only becomes difficult when there is tubal blockage. All right. Okay. I haven't gotten a period for 3 months. My doctor has done all blood work, which all came out fine. He prescribed Provera and Clomid yesterday because I am TTC. How long do I need to? I don't know. So Kerry, I'll probably need to have like a one-on-one with you. That's very unusual. 3 months without flu. That's very, very unusual. And I don't know the blog or the extent to which investigations were carried out. I don't know the names of the tests you did, but it would be ideal, or it would be great for you if we have like a one-on-one. Now, if you want us to have like a one-on-one, there's a link on my Instagram bio that you can click on. All right, then you book a session. After the session has been booked, I'll contact you, then we have a discussion that may avail me the opportunity to study your report, study your history more in detail, and then be able to advise you accordingly. But certainly it is unusual, it is abnormal for your period to miss for 3 months when you are not breastfeeding, you are not pregnant, you are not using any hormonal contraceptives, okay, you are not menopausal, and you are not just starting your menses. It's not normal. All right, next question. Greetings, doc. I have a sister who has given birth to 2 children. The last one is almost 10 and no other pregnancy. What checks can she do? Well, all right, Anthony. So the investigation is going to be both ways, on the husband's part as well as on your sister's part. All right. So for your sister, she certainly will need to do an HSG. That's like the hysterosalpingography. It's a test that helps to look and study her womb and her fallopian tubes to know whether the tubes are fine. All right, so she need to do that. She also need to do a hormonal profile, a day 3 hormonal profile. If she has a 28-day cycle, she will need to do a 21-day progesterone. All right. She will likely need to do yes, a transvaginal ultrasound scan or a pelvic ultrasound scan at the very least. So let's start with those ones, then we can advise. So for example, now if I saw her hormonal at the 3 hormonal profile, I may be able to tell whether or not she needs to do another test that we call AMH. AMH is anti-Mullerian hormone assay. It's a test that helps us to tell whether or not the woman still has eggs in her ovaries to be able to ovulate. All right. So if the AMH shows that there are no eggs, it may be a case of early menopause or something along that line. All right. But at the very basic level, let her do an HSG. Let her do a transvaginal ultrasound scan or pelvic ultrasound scan. Day 3 hormonal profile. Day 3 hormonal profile is the 3rd day of her period. So she goes for hormonal profile, and which of course will include luteinizing hormone, follicle stimulating hormone, estradiol, prolactin, testosterone, even possibly thyroid stimulating hormones. All right, she needs to do a thyroid function test, and then Yes, then she goes for the 21 progesterone if she has a 28-day cycle. So let us start with that. Then the husband needs to do a seminal fluid analysis at the very least. Please, doc, what are the possible reasons why implantation won't take place during super ovulation? Well, so if implantation does not take place, let me explain it now. All right. If implantation fails to take place, there are two explanations. Either number one, pregnancy did not happen. All right. So either the pregnancy did not happen, or the pregnancy happened but it miscarried. All right. So there are some pregnancies that miscarry before your period is even missed. So let's assume that you had sex today, a fertilization took place. All right. So pregnancy happened after you had that sex because fertilization took place. Now, it takes around about 5, 6, 7 days for the embryo, the resulting embryo to move from the ampulla. That's the point where the fertilization takes place, all the way down to the endometrium to implant. All right. During that travel, during that movement, anything can happen. The pregnancy can miscarry. If the pregnancy miscarries or fails to establish, you are going to get your period as expected. You will probably be thinking that you didn't get pregnant, but a pregnancy actually took place. It's just that you didn't know because you didn't miss your period. The pregnancy miscarried at the very early stage, so you didn't suspect a pregnancy. Another case would be, okay, maybe as the pregnancy got, or the embryo got to the endometrium, the endometrium was not thick enough to allow for attachment. All right. So this is a case where a woman has a very low, or has very a low amount of progesterone. Progesterone is the hormone that helps with preparing the endometrium for implantation. So if she has issues with her progesterone and the endometrium is not thick enough to allow for attachment or implantation, the implantation can fail. It leads to a miscarriage, obviously. So it's either a miscarriage or a failure of gestation or pregnancy to happen. Yes. The superovulation should not even come into the picture. All right, you can have superovulation and still not conceive, whether it's one ovulation or superovulation, whatever it is. You can ovulate without conceiving. Okay. Please, doc, what are the possible reasons why implant? Okay, I think I just explained that. And I have dermoid cyst on my left ovary. That dermoid cyst, it now becomes, it becomes the whole thing complicates the whole issue. So who knows? Dermoid cyst. So now it's beginning to make sense. So they need to check the other ovary. Is that ovary ovulating? Is the ovary releasing eggs? Because one issue with dermoid cyst is that if it gets complex enough, it can affect the function of that particular ovary. So if it's that ovary how do I explain it now? So if the ovary where the dermoid cyst was the one that was releasing eggs, and the dermoid cyst now has gotten so complex that ovulation cannot take place, then you will not ovulate, which obviously will explain why why you may not have seen your period for that long. All right, because oftentimes once you start having problems with ovulation, the first sign that you see is irregular cycle. You notice that your period becomes very regular. All right, so for those asking me how much is a session, if you are booking a session that has to do with sexual or reproductive health, a session online is 15,000. Any other health issue, it's 10,000. So if you are contacting me for sexual or reproductive health issues, it's 15,000 per session online. All right, if it's any other health issue, maybe you have chest problems, you have headache, or that one is 10,000 naira. All right. Any other question before we bring the session to an end? We have been here now for 34 minutes. Meanwhile, guys, if you're here and you have not subscribed to my YouTube channel, I am pleading with you. All right, please help me grow on this platform as well, just the way you helped me grow on Instagram. Subscribe to my channel, turn on post notification. Trust me, the plan I have for YouTube is going to be insane. The plan I have for YouTube is going to be insane. All right, we have some very big projects coming up on YouTube. We're going to change. We're going to change a lot of things when it comes to health content in Nigeria. Trust me, big things are going to happen. So help me grow. Subscribe to my channel. You can also invite someone, introduce the channel to someone else. There are some very awesome content, on the platform as well. And by the way, I have noticed that when people come, they only pay attention to the short videos, the 5 minutes videos. The live sessions, which obviously you see 30 something minutes, sometimes 40 something minutes, sometimes they have already answered your questions. So when you come and you are consuming the shorter videos, also take time to go through the live sessions as well, the longer videos, because some of the questions you have, I've already treated them, and by going through the longer videos, you have your questions, or you have the answers to your questions provided to you. All right, I think how to treat a UTI. Have you done test? First of all, go do a urine MCS to know what pathogen is responsible. All right, because part of the one of the things that a urine MCS does is that it finds out the antibiotic that is sensitive to that particular pathogen. So, for example, if you have E. coli, causing a urinary tract infection, they will show you antibiotics that are sensitive to E. coli. They will also show you those that are resistant. So that you don't go and start using a resistant and an antibiotic that is resistant. It's not going to work. All right. So it's important you do a urine MCS. It will show you antibiotics, and your doctor will it makes it even easier for the doctor. He just prescribes you the antibiotic. But first of all, do a urine MCS test. All right, so that you don't abuse antibiotics. How do I know if there was a miscarriage or thin endometrium as a result of low progesterone? Well, if you do a hormonal profile or a progesterone assay, it will be able to tell you. So you see that the progesterone level is lower than expected. Now, for a miscarriage, for that kind of a miscarriage, you will not be able to know, trust me, because you won't know that a pregnancy has happened. All right, you won't suspect a pregnancy at the point of which your period comes, so you won't know. You can't tell. All right, you can't really tell for that particular one. But again, for progesterone, you can measure your progesterone, do a hormonal profile, and then you'll be able to see the value. All right, guys, that'll be all for today. Thank you very much for joining the session. For those of you who want to have a one-on-one with me, there is a link on my Instagram bio. If you click on that, link, you'll see an option to book a session, to make an inquiry or to book a session. Click on it, and it takes you to my WhatsApp business account, where my PA will put you through. And once the session is booked, I will contact you, and then we'll get to talk. All right, that's it for today, guys. Thank you for joining, and do have a very beautiful evening ahead. Bye.